My name is Dr. Stephen Nathan. I'm the Medical Director of the Advanced Lung Disease and Lung Transplant Program at Inova Fairfax Hospital. Came here in 1996. I even remember the day I started, primarily to run the lung transplant program. But if you run any lung transplant program, then you have to do advanced lung disease. So when I talk about advanced lung disease, I talk about diseases such as interstitial lung disease, IPF, pulmonary hypertension, COPD, sarcoidosis, cystic fibrosis, and there are a bunch of other quite rare conditions that we also deal with as well. I enjoy many aspects of my job. I love seeing patients, relating to them, talking to them, getting to know them, which is sometimes difficult in the clinical setting, especially if you have not such good news. But to me, that's a big part of what I do, is to try and find a connection and resonate with patients. I actually had a very nice compliment paid to me one day by, I believe it was one of our coordinators, who said, "Gosh, you know, Dr. Nathan, when you're going to see a patient, it's very clear that they have your undivided attention, that you're there 100% for them." And that resonated with me, because I like to believe that if I'm in the room with a patient, then I'm 100% there with the patient in terms of tapping into my experience, my knowledge, and everything that I have to offer. Every patient is different, and there's certainly patients who can live a long time past the median survival of the disease. What we try and accomplish in the context of the Advanced Lung Disease Program is to optimize patients' longevity as well as their quality of life. As the Medical Director of the Advanced Lung Disease and Lung Transplant Program, I like to say that we're in the business of trying to put ourselves out of business. What I mean by that is that ideally we wouldn't want any patient to go through and have a lung transplant, and hence a lot of our focus is on the management of advanced lung disease to try and delay and avert disease progression and prevent transplant, which is the final safety net for those patients who have ongoing disease progression. The program has grown exponentially, and in my somewhat biased viewpoint, we are the premier advanced lung disease program in the country. Now that comes with a little bit of bias. The folks I have around me in terms of physicians, support personnel, our APPs, our nurses, our coordinators, everyone is outstanding. And I think if you build excellence, it attracts people of similar ilk. So I don't think that we have a weak link in our team. We take comprehensive care of all of our patients and their loved ones, and we do ultimately what we feel is in our patients' best interest. So by coming to the Inova Advanced Lung Disease Program, we have a continuum of care all the way from early disease, whatever that might be, through advanced disease, with lung transplantation as the final pathway for those patients who fail all other forms of therapy.